And of course, let's welcome Dr. Haniff Benjamin. And of course, we are here to speak about emotional trauma after election. Good morning and welcome, Dr. Haniff Benjamin.
Lester, good
Good
morning.
morning.
Thank you. Are you hearing me?
All right. I'm going to have to work with you through my earpiece. All right. Let's try again. Good morning.
Testing one, two, 1, 2. Blessed, good
Very
morning.
good. Good to have
Blessed
you.
Monday
All right.
morning to
Let's
you.
go
How are
through this.
you?
Any form of loss, you do go through your 5 stages of grief.
Mm-hmm.
Clearly, there are those who will pretend that they didn't feel the loss and cover their emotions, did not shed a tear. How important it is for, like the MPs, for example, to cry, bawl out, express their disappointment through that fashion.
Well,
How important is that?
I like where you started because you were peeping at my notes clearly. Um, and I don't want to speak to the MP per se, but I want to speak to all of Trinidad and Tobago because you are quite right. You are dealing with the 5 stages of grief: denial, anger, bargaining, depression, and acceptance. And for each and every person individually, they would experience these 5 stages very personally, very different, because no two people grieve the same, right? Every single person grieve their own unique way. And so, what does this 5 stages look like for for a person? And so, when you talk about on the wider scale emotional trauma, you have to consider an emotional turbulence to, in response to an event or a series of events, and the election was an event. And so, in every scenario, you have victors and you have spoils and you have changes. And so each and every person is going to go through. So I don't know if they are pretending to not go through the stage, because with grief you go through the stage sometimes not knowing that you are in fact going through the stage. Denial would look very differently for everyone. Anger may be very different. Some people may be physically angry, some people may be verbally angry, some people may express their anger in a manner of protest or silence. Bargaining, what does that look like? You know, you see people making sudden changes, big monumentous changes to their life after defeat, after a loss, and sometimes you ask yourself whether these changes are in fact in line with normal projection of how one deal with grief, or is it a negative symptomatology of the grief that people are going through? And so a lot of times, brother B, people believe that grief is for someone who may have died. But to be quite honest with you, many of us go through grief for people who are living, situation that are current and situation that may have changed. And so the same emotional turmoil that you would feel much as if you would have lost someone is the same thing you go through when you are dealing with some kind of difficult change in an event.
When you do not release the emotion, be it you express it through the 5 stages, or just a simple cry, or a bawl out, or a holler. Years ago, they used to say, "Ato holler." And after that, they are okay. But those who keep it inside, all those that pent up emotion that has not released can affect you physically. Your head, your heart, and the viewing organs in your body can be affected because you did not release, Dr. Benjamin. Speak to those who keep those emotions inside for fear
Now,
that
very
somebody may say, "What are you taking
interestingly,
on that for?" As a matter of fact, you
no,
are taking it on because you did not release. Bring the difference there and how important it is for us to release that pain that we're feeling.
you're on point this morning, brother B. You're on point because as a forensic and clinical traumatologist, people would call me on the brink of a death. So there's a tragic accident. So a company may call. There might be something happening on the work, and someone may call. And I would always say to people, while the intervention is critical, the initial release is equally as critical. And when I say the initial release, I am talking about grieving in the most traditional way, the hollering, the bawling, the screaming, the gnashing and the grinding of teeth. Sometimes clinicians, psychologists and stuff, they run in to try to usurp that true and natural grieving process. And sometimes when that process is not happening, people go into complex grief because now depression sets in, anxiety sets in, and other mental health challenges step in. So that initial natural release is so critical. Whatever. Sometimes I tell people go on the beach and scream. Go wherever on the mountain and bawl and holler. Sometimes I say to people, don't tell people, don't take it on and don't worry with that. And those are nice things, but brother B, we say horrible things at the most difficult time for people because we don't know what to say. And so that initial release is going to be important. So I tell people sometimes, I don't mind coming to the scene, I don't mind coming to the home, I don't mind coming to the work, but I will not stop a person from going through that initial release because it is important for a person to go through that. But interestingly enough, Brother B, what you spoke about there is keeping the stress inside. And we are living in a very difficult society, a very, very difficult society. And I'm going to speak directly to our leaders because it is so difficult that when you read social media, it's almost as if I have to take a moment away from it because the comments are so vile. The behaviors are so vile on either side of the spectrum. Again, going through the change. And so we have to understand sometimes it is difficult for a person to holler, to go through that initial stage of how I feel because society has put a certain type of ring around me that prevents me from doing so. It prevents me from speaking how I feel. It prevents me from saying how I feel in a healthy way. It prevents people. So we have to be considerate that change is ever so present. Change is constant, and change happens to all manner of things and people. And so we have to help people to navigate difficult changes, not by being racist or by being classist or sexist. And so we need to get away from the ist and those type of behaviors to allow for the proper movement of change to happen in a healthy way. And our social media is not doing a really good job of that. Well, I guess it's the people on social media, really. And so we need to pay particular attention to what we say, how we say it, what are our intent when we say what we say. Those are going to be critical things in this healing process because Brother B is one Trinidad and Tobago. And regardless of where you sit and what divide you sit, you must recognize that as a country, we all need to move forward.
Very good. I want to bring a loss of an election does not just affect ministers or area representatives, but there are people who rely on these positions or political appointed positions for the survival. They may have taken out a loan, intended to finish paying the loan next year. However, their party did not win. So they have to suffer, quote unquote, for the next 5 years because in some cases they will not be able to be employed because there's this political spike. Um, that affects a particular sect of people, and it is real. How do individuals who suffer that fate of not being able to meet their bills, in some cases may lose their home as a result of not being to earn an income because they were hired from a political standpoint and so on. Let's speak to those individuals who will have to be, well, they're traumatized by the result, and how do they navigate the rest of their lives going forward?
Brother B, while I don't want to get too deep into the political arena, I think what you're speaking about is real. However, our party system has been what it is for the last 50, 60 years. That hasn't changed. And so with every political movement comes their political directorates from state board, all the way up. And those things are and remain part of our political system. So the hope is in preparing for the change, and this is something that we need to talk about. In preparing for the change, one must have understood that as an appointee, appointment must end, unless of course your party is in power forever. But I truly believe that people at this juncture should be renegotiating their personal lives and renegotiating where they are in relation to their professional skills and stuff like that, to figure out how to navigate those emotional turmoil, having conversation with their families and stuff. But the hope is, or the hope was, or the hope should have been, that those conversations should have been taking place given the fact that our system is what it is, and I don't see it changing. I also believe that we need to understand that change is constant. And sometimes we are so embedded into being fixed in one place that we don't recognize that when change comes, we are affected by it. And so you need to pay particular attention to that. And I really think and I hope that people would have been paying attention to that. I mean, granted that everybody wants to win, you must recognize that there must be winners and there must be losers. And you must also understand how the game is played when one win and or when one lose.
When does the traumatist or a person who is an expert in dealing with grief or need somebody like you, and where are individuals like yourself, given that you're a traumatologist, that's a term, when should one seek the assistance as to cope, the coping mechanism? You might advise, but however, they may need to sit with somebody who could guide them accordingly, dealing with the grief or the loss that they are going through, and the reality of not being able to pay bills and where they can end up if not given the professional help. So let's speak to that. How do you seek the right help when you're dealing with such emotional trauma?
In most instances, Brother B, grief is a natural process that works itself out in most instances. In the majority of scenario, grief works itself out with time, of course, and self-reflection and self-healing. I think grief works itself out. And just like no other, it will work itself out for persons. People will do what they need to do to survive, and people will maneuver accordingly because we are resilient people. And the hope is that people would find their footing one way or the other. It is also my belief and hope that as a country we move away from the sacking or whatever you want to call it. But when a professional is required, I think is when persons are stuck in an unhealthy practice. So, for example, if denial or anger or bargaining or depression or acceptance, and if you are stuck at that stage and that has now created a new layer of trauma, a new layer of challenge, I think it is going to be time for you to speak to a professional to help you navigate through the difficulties. I tell people to look out for your friends and family, and if you find that they are not doing well, then you should reach out to a professional, like myself or someone else. But in the main, Brother B, I think this grief kind of works itself out as people navigate. What I think is going to be important is as a country we create safe space for people to be who they are, say what they say, and experience what they experience in a healthy way, and not really think. I think where the country is at is it's a big change, a huge shift in the dynamics of our diaspora, and I think people are going to take a moment to get accustomed to it, but I also think that we will be okay.
Yeah, we are resilient, obviously, in some cases, but there are people who never uh, allow themselves to let go. It is convenient for them to hold on to the pain and speak about it for, what do you call that? All right, for example, let me just go. Somebody dies in a family, and that person, goes to the funeral and so on. They may cry up until a month, or you mention the name, and they go back into that grief and they stay there. they stay in it for the rest of their lives. They never let go. What do you call that? First of all, I'm sure you're aware of what I'm talking of. I might be able to explain it in the terms that you may be trained as to detect. But I'm dealing with people who hold on to grief forever. Let me put it simply, and it's not a natural thing. It's convenient for them. It brings a safe space for them because they like to stay in the morning in the hate, in the painful state. You understand the point I'm making? And
Yes,
how do you treat
what
it?
you're talking about is when a person is stuck, generally, in one of the stages. Generally, people are stuck in the stages of grief. And for some, because of the memory of what was, they stay in that place. And so it is important for people to understand that, grief can snatch your life from you in terms of you become paralyzed in where you are. And so you need to be cognizant of that as you work through the stages. The hope is, again, that people around you or you become astute enough to recognize that I am not moving and I need to get the help to move. And I think helping people through those stages, the stuck places, going into what is the difficulty in those areas and helping them move from that area to the next is going to be important. And of course, that is where the professional comes in. Some people turn to God, some people turn away from God, some people turn to substances, some people turn away from substances. So people go through a myriad of changes as they go through the phases. And some people are stuck at certain stages because of the life that they may have lived, because of the experiences, and of course, because of their level of resiliency. Those are going to be important things to work through. But again, in this scenario, I am convinced that this may not be, a scenario because this is something that I think Trinidad and Tobago kind of accustomed to. This is the cutthroat of politics, and this is the thrust of where we are as a people. And I think that people will, in time, work through those difficulties. What, as I said, and I want to reiterate, what is going to be important is helping people to not be bitter and to not allow the bitterness to erode humanity. Even in winning, we need to be humble because when we win and we lack humility, it means that we are hurting people. And our goal should never be to hurt people. We should be, yes, we won, we fought and we won, and somebody should win. And in winning, we need to be graceful, we need to be humble, and we need to say, how can I utilize my win to the benefit of people? Because you're talking about power, inherent, coherent, and all manner of different types of power. And how can we use this win to really develop people, to move a country forward? And that should always be the focus.
Mm-hmm. All right, and so yeah, and in you spoke about the winning, but the losing is a burden that some people, as I said, mentioned, carry forever until maybe the 4 years or the 5 years, and then they are able to redeem themselves, hoping for victory again at some point in time. But to cope with the loss, as I said, the real issues of survival is paramount in their view. Cannot find employment in some cases, and you're not getting into that, but that's the reality for some, because they in some cases they have to leave Trinidad and Tobago because they would not be able to find employment and that sort of thing, given that level of or lack of humility on the winning side to accommodate those who may possess certain skills that could be utilized, but because of what we call spite. That would be an emotion, or that would be part of how we distribute our vengeance. Because in some cases, winning is to exercise that very spite, that very vengeance against, quote unquote, what they call the enemy. How do we label, and how should we when we are campaigning and so on, see each other, fellow human beings who take a different side, as an enemy or as someone that is not supposed to be considered a friend? And because I could tell you of relationships, husband and wife are on the two different sides, and they live and they communicate and they get along. But there's some who just see each other as enemy, and that in itself affects the relationship going forward, even after election.
I, 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 hmm. Those are powerful words, vengeance and enemy and stuff like that, Brother B. Those are words that I would not want to espouse, or the hope that as a people who live in this beautiful twin island, who experience the beauty of what Trinidad and Tobago is, and to experience the love and the warmth of its people in this very diverse cultural, religious place. I would hope that we are not speaking to vengeance, and we are not speaking to evil, and we are not speaking to those things. While I understand politics can be very brutal at times, the hope is that when the day at 6 p.m. has ended and the result is called, and you go through your emotion, we are able to be that people again who are to love and to care. And that is why I'm so concerned with some of the things that I'm seeing on social media. And that is why my call to all leaders, to their supporters, to pause, take pause, and allow people to grieve in the way they want to, in a healthy way. And so the hope, Brother B, is that we are not going down a road of vengeance and all these type of atrocities. That is not who we are as a people. That is not what we want as a people. We want to be able to rise and to be able to do what we can wherever we can, and to be able to really think, because there are people who sit on no side and is willing to help. There are people who sit on one side and might be willing to help, and they may be turned away because of the perception of vengeance and race and all these foolishness is something and which I definitely do not subscribe to. Because I think all people who have skills and talent come to the front. Let's see what we can do as a people to really navigate Trinidad and Tobago um, in this beautiful twin island state.
Dr. Benjamin, I'm so enlightened that you can speak to it directly the way and call it foolishness, because that only keeps our people from progressing. And so I really want to thank you. Anything else you want to add before you go, dealing with the trauma that people can experience after election?
People will go through their stages. Some people may not know that they're going through the stages. So we need to just be kind, we need to be patient, and we need to love. We need to help people to understand where they are. As a country, we need to understand where we are and where we want to go. Your own individual role in building Trinidad and Tobago, your role in wherever you sit is going to be important. And so pay attention to the trauma, pay attention to how you feel, pay attention to your emotion, honor how you feel, and treat with it in a healthy way. And if you feel as if you cannot deal with it in a healthy way, reach out and get help. Right? We are here, always here to help, and we just do that.
All right, we want to thank you for being with us this morning, Dr. Benjamin.
Always a pleasure.
And always a pleasure. Yeah? Take care. Chat again.